Hello, everyone, and welcome to 360 Degrees of Care, understanding your risk and monitoring for recurrence for patients and caregivers, a free support program for patients and caregivers facing breast cancer. The program is being offered by the Breast360 Foundation and Natera, and we're extremely fortunate that tonight's program is being facilitated by breast surgical oncologists Dr. Sean McKinney and Erica Giblin. And we're looking forward to hearing your questions. As you think of your questions, feel free to write them in the chat. Then after Doctors McKinney and Giblin share with us how you can take charge of your care using a 360-degree approach, including understanding your family's genetic history and monitoring for risk of recurrence, we'll go through and answer your questions. We'll start with Dr. McKinney. Dr. McKinney, would you like to share a bit about your background and expertise, and then we'll start your presentation?
Sure. Hello, everyone. Thank you so much for the opportunity to talk to you all tonight and share information that we both feel is, very important for patients and families. I am a breast surgical oncologist and have been in practice for over 22 years. I currently practice in New Orleans, Louisiana, and am just happy to be here to share what we do and to give more information. So we can get started. You can go to the next slide. So, the basic part of what I want to share with you all is what Natera has when it comes to monitoring and discovering genetic abnormalities, and why that is so important for me as a surgical oncologist, and why it's important for your team to know that these things exist. So, on a basic level, um, we need to understand what genes do. Your DNA is your instruction manual. It is a blueprint. Kind of how I explain it is it's like the blueprint for the basis for a house. And it's used to construct and maintain every part of your body. Every gene has a specific function and job. And if you look at genes, it's almost looking at like a page or instruction manual in the building of a house. But those things can have errors. And that's how I liken it to a mutation. Sometimes mutations are small. Sometimes it's just a misspelling. Sometimes it's that we know something has occurred, but it has no other effects. But sometimes mutations are like a missing page in the blueprint. Maybe the whole page for the piping structure is not there in the house, or electronical structure and plans. And that will greatly affect the structure and function of that house. Next slide. So, when we look at cancer in particular, most cancers that we diagnose are sporadic or random. Most breast cancers and other cancers are just because of that individual. They develop over time, they develop because of things we're exposed to, things that we expose ourselves to, environmental triggers, and they are not passed down from family member to family member. They're not contained as a part of your blueprint or part of your DNA. But there are some that are definitely passed down. There are some mutations, some genes, some genetic factors that are present in families, and they're written into the DNA. You wouldn't know it until an abnormality occurs, or if you're tested um, early and they're found. But most of these genes, when we find genetic mutations, they really are not present very commonly. They're only about 5 to 10% of the population. But as we discover more mutations, that number will certainly rise. Next slide. So, when we find a positive gene, though, a positive mutation, and that mutation is significant, it can greatly increase your chances for developing breast cancer. Usually, the number that we give the general population at average risk is that 1 in 8 women will develop breast cancer over their lifetime, which is about a 13% risk. But if you have a genetic mutation that's significant, a page out of that blueprint that significantly affects the function of other cells, then that impact can be up to an 87% risk. And that's extremely important. That can certainly explain why, if you're diagnosed with breast cancer, why that occurred, but it can also give valuable information um, to your treatment team and also the rest of your family. Next slide. So there are a lot of mutations that are present. The ones that most people know about and affiliate breast cancer with are the BRCA1 and 2 genes. These genes, when they are or these mutations, when they're present, they are linked to hereditary breast cancer risk. They're passed on um, throughout generations. And they're not only significant for breast cancer risk, which we actually have, good screening for, but ovarian cancer risk, which we do not have great screening guidelines for. So if you are positive for either one of these mutations, then it does not just mean that there is a breast cancer risk there. There also is a GYN panel that looks at genetic mutations related to not only breast and ovarian, but uterine or endometrial cancer and some other markers that can have other cancers associated with them that are present as various syndromes. And we'll talk a little bit about that. And then there is a multi-cancer panel. And this is a panel that's done when seemingly some things may not be related. You really don't have a lot of breast cancer in the family, but there could be other cancers that are present in males and females for many different generations. And a lot of times we have to do a multi-cancer panel because unfortunately, a lot of patients and a lot of families do not know their family cancer history. Next slide. So, is testing right for you? Um, these days, with a breast cancer diagnosis, it is usually recommended that genetic testing is at least offered. But for the most part, for us, at least through my practice, especially with younger age at diagnosis, multiple family members with other cancers, male breast cancer, which can also be present. Most patients are offered and encouraged to get genetic testing. It is why we ask so many questions about your family history, the age that they may have had cancer, if they're still living, what type of cancer it was. And it's important for us to know not only on the maternal side, but the paternal side of the family. So we ask multiple questions to try and see if any of these syndromes or specific mutations could be present. Families that have very rare cancers like ovarian and male breast cancer are automatically um, encouraged to get genetic testing because those cancers occur so rarely that they are often associated with a genetic mutation. And then sometimes some families who have an unknown family history. Maybe you don't know much about the paternal side of your family. Maybe there were family members who passed away, but you don't know why. Or we have some patients who are adopted and don't know anything about their family and their heritage or family line. So those are patients to try and figure out if there's something that could explain why they're have developed breast cancer. Next slide. So we have, two different arenas where this is important. It's important for those who are diagnosed with cancer or breast cancer, but it's also important for those who are not diagnosed with cancer, because we want to get ahead or be proactive about identifying what your risk really is. Everybody is not at average risk. You could be at a higher risk for the development of breast cancer or the highest risk if you have any one of these mutations. So, if anything is found positive and you do not have a cancer diagnosis, then there are multiple ways that we can screen for other cancers that you could be susceptible to in the future. This could include imaging at an earlier age, certainly more doctor's visits for clinical exams, and sometimes it can also include medications to reduce risk for the development of cancer over your lifetime, and also looking at things that you currently take in order to try and see if those medicines or supplements are things that enhance or could continue to increase your risk for the development of cancer. So, this is important for us as I run a high risk clinic in order to identify patients who are positive gene mutation carriers and those who are at high risk in order to get them screened earlier. Next slide. So why do I, I'm a surgeon, right? So I like to be in the operating room. But why do I need this information? It really is important because it greatly impacts what I offer to patients when it comes to surgical intervention when they have a diagnosis of breast cancer. Um, if you even have a very small cancer, that is easily treated with a lumpectomy, but you carry one of the susceptible genes like a BRCA1 or 2 gene that greatly increases your risk for the development of another breast cancer over your lifetime, then we need to talk about what we call prophylactic mastectomies, or removing the majority, if not all, of the breast tissue in both breasts, in order to reduce the chance that you ever have a new diagnosis of cancer in the breast over the rest of your lifetime. So it can change the surgical plan regardless of the stage or presentation of your disease. It can also change when we partner with immediate reconstruction, our plastic surgeons who provide that service, we will start to incorporate that into your treatment plan. And then it really does give a lot of information with regard to your team, because if you are positive for a genetic mutation, occasionally you may be eligible for specific treatments that work best to prevent recurrence. And a lot of these medicines are available only if you're positive for a specific mutation, because they can impact your survival and decrease the chances that cancer comes back. So your treatment team is always, trying to accomplish two goals. One is, if you have a breast cancer, to get rid of what we know, but also to do everything possible to prevent it from coming back or showing up in other areas of your body. And that's really the goal of initial treatment. Next slide. So we talked about a little bit about this prophylactic surgery, even in patients who are high risk and gene mutation carriers, removing the breast even before they have the the chance to develop disease or removing the opposite breast in someone who presents with breast cancer. But and it's because it can greatly reduce the chances that you are diagnosed with breast cancer by just reducing the tissue that is available there to develop into cancer itself, removing the majority, if not all, of the breast tissue. And then targeted systemic therapy. When we talk about advances in breast cancer research, it really is looking at identifying and developing therapies that target abnormalities at the cellular level. This is where a lot of research is going, and there's specific medications that affect how the cell functions and trying to target those pathways that are mutated or changed so that they don't continue to cause a problem. Next slide. So these are the tested genes that Empower has. And some of them, we can usually pick what panel we would want, depending on what we think could be present in the family. So of course, those diagnosed with breast cancer will automatically get tested for the set of genes under the breast and GYN panel. And then a lot of times we'll do an extended panel. So other key mutations that we test for in the last row to try and identify some less common syndromes that could be present in families. Lynch syndrome, if there is a lot of colorectal, young patients with colon cancer, endometrial cancer, then a Lynch panel specific can be added on. But for the most part, you will likely get a breast and GYN panel and then an extended panel for those less commonly identified mutations. Next slide. And why is this important? It's really important not only for you, but it's important for your family. A lot of these mutations are handed down. They're what's called hereditary. They can show up in other family members. And identifying a specific mutation can allow other family members to be tested for that mutation to see if they carry it. Not all mutations are passed down um, directly. Sometimes they can skip or not show up in a sibling or a child. So it's important that uh, other family members are individually tested for the specific mutation that is found. And then those family members that are positive can certainly be started on an increased surveillance or watch program, advanced testing, earlier testing, and increased screening. Next slide. So very simple steps. How do we do this? We do this in the office. Uh, Usually for me, I will talk about genetic testing at the first visit with a new diagnosis, or at least at the second visit. We are able to get a sample either by blood or saliva. The lab read usually takes about 2 weeks to come back, a lot of times much less time than that. And then we have that information in order to bring into your treatment plan. So while you're getting other workup, while you're getting either MRI or meeting with the other consultants, then we're able to wait for genetic testing results to be able to incorporate into your treatment plan. Next slide. What the results mean. So you can get one of three results. Certainly a positive, and then we are able to identify exactly what needs to be done for that positive mutation and what its implications are. a negative, meaning that nothing was found that is detrimental, and then a VUS, which is a variant of unknown significance. It's something that's found that has not been shown to have any outcome that's measurable, but it continues to be monitored, meaning that the database of that specific abnormality continues to be monitored so that if anything comes up in the future or new information is found, then we are able to give you that new information and whether we need to change clinical course. Next slide. So how do you empower yourself? Next slide. It's important, know your family history. So know as much as you can about your family, both sides of the family, maternal and paternal. Know your own risks, and now you know your options. So I thank you very much for this time, and I will turn it over to Dr. Giblin.
Hey guys, I'm Erica Giblin. I am a breast cancer surgeon based in the Indianapolis area. So I'm going to talk to you about something called Signatera. So what is that? Well, it's important for breast cancer patients and breast cancer survivors. So when I have a new breast cancer patient come in to see me, we go through what their breast cancer is, what do we have to do for treatment based on this individualized care pathway for the patient. But even at the new diagnosis visit, and definitely with survivors, their questions are, how do I follow it and make sure the cancer never comes back, right? Because ultimate goal for the patient and the providers is we want this thing cured. We don't want this thing to ever come back, right? But how do we follow the patients? So Dr. McKinney and myself and many other breast surgeons, we have survivorship clinics where we follow the patients after they've completed their breast cancer journey and their breast cancer care. So what is survivorship? Well, we're following the patient, we're examining them, we're seeing how they're doing with range of motion after surgery, how are they doing on their medications, how did radiation go, all that kind of stuff. But we're also following them with mammogram, breast MRI, because we want to make sure if cancer is going to come back that we catch it as soon as possible. So those are all helpful things, right? Clinical exam and pictures. But what if we had another tool in our toolkit to help us, maybe a little more finesse, or at least an additional thing where we can follow our patients to see if the breast cancer is coming back? Well, that's where Signatera comes in. So let's dive into it. Next slide. So in terms of Signatera and even monitoring patients, we talked about images, right? So you got mammogram, you got MRI, you got other things. But what about the blood? Can we monitor the blood? Well, turns out we can. So when a breast cancer is forming, the breast cancer can shed little pieces of it, like little pieces of its DNA into the blood. And then that little pieces of DNA can circulate around. So is it possible that there's a test that can detect the little pieces of DNA that are floating around to help us determine if a breast cancer is coming back? Or even, I mean, mic drop, if somebody's getting chemotherapy before going to surgery, be nice to know, like, how well is it working, right? And we can have pictures after chemotherapy is completed to see if the tumor shrunk. But wouldn't it be pretty cool to also follow the blood? Because if there was stuff in it and the stuff goes away after chemotherapy, I mean, that's a really good sign, right? So this is where blood testing comes into the fray in terms of monitoring our patients. So it's a whole new paradigm that's super exciting. Next slide. So there's a test called Signatera. And what it's doing is it's surveilling for residual disease. Okay, so let's just go through that. So your breast cancer has little areas of DNA that are screwed up, okay? And that's why it made cancer. The cell became abnormal. So this specific blood test can help look to see if there's any cancer remaining after chemotherapy, as we discussed. And during chemotherapy, we can draw your blood and track and see how is the cancer responding to chemotherapy through the blood. And once again, as I said, for our survivors, following along with them, not only with pictures, if recurrence is to happen, the goal is to catch it as early as possible. So going through the blood may actually aid us in those efforts. Next slide. So in terms of following the blood, who can actually benefit from this, right? Well, all aspects of breast cancer care can benefit from this. From patients who are on chemotherapy, it can help us determine how well that chemotherapy is working. Because if somebody starts out initially with the cancer DNA in their blood and then they get their chemotherapy and that goes to 0, that's great news, right? We're not seeing any cancer DNA circulating in the blood. So that suggests that the chemotherapy is having a tremendous effect. And then once again, going into survivorship, if cancer is to come back, we talk about PET scans, MRIs, and mammograms, and those things were good, but it's human technology, it's human imaging. So it can see down to certain size, but below a certain size, it is hard for any imaging to pick up even a couple breast cancer cells. Pictures can't see something that small. So that's where following the blood can be a tool to help us, because it can see these really little tiny DNA fragments in the blood that pictures literally can't see. And then monitoring treatment response. Some people get chemotherapy before surgery, some people get chemotherapy after surgery, some people are on immune therapies like Dr. McKinney talked about, or PARP inhibitors for patients who carry out BRCA gene. So monitoring how these patients are responding to the medicines that they're getting, right? Because once we do surgery, the cancer's out, right? It's gone, we can't really see anything. So it's pretty cool that we can monitor the blood to have another way to see, are these treatments really working? And is my cancer gone and it's staying gone? Next slide. So this is a super important slide. Every person's cancer, breast cancer, colon cancer, doesn't matter. Every person's cancer is individual to them. It is unique to them. So it is essentially like a fingerprint, and Signatera is basically using that fingerprint to monitor how you're doing. So let's go through how that actually works. Next slide. So in terms of the mechanics of like, how do we even find this DNA and how do we monitor it? What happens is when you have breast cancer, you get a core biopsy. So they got to get a little piece of tissue because they got to be able to see with a microscope, what kind of breast cancer is it? And I'm sure everybody knows the words prognostics, like is my breast cancer fed by estrogen, progesterone? Does it have those HER2 receptors popping out of it? Because that's important for treatment. We want to cure this stuff, right? And those are important features, but the Signatera looks at 16 DNA elements unique to each patient's breast cancer. So that's where it's sort of like a fingerprint of your specific breast cancer, different from the other patient, different from the next patient. So it takes that specific fingerprint, and then your blood is drawn at intervals, okay, at defined time periods, to look to see if they can see any of that fingerprint in your blood, any of those 16 DNA elements. Okay, that's very important. The test is custom built to you as the patient. So it's a blood test, right? So a lot of patients, somebody even tonight might say, well, how often should I be getting this blood test? That is a discussion between you and your provider. If you're getting chemotherapy first, your provider may get your Signatera blood test every 8 weeks to follow how your response is doing. Maybe it's every 12 weeks, depending on what kind of chemotherapy regimen you're on. Before surgery, we may draw a Signatera and see if we see any of that fingerprint or cancer DNA in your blood. Afterwards, finishing radiation, you're going on into survivorship for the next couple years. We may draw the Signatera at different intervals, could be every 12 weeks, could be twice a year in terms of spot checking to see if your breast cancer has come back. Can we find those fingerprint, 16 DNA elements in the blood? Or is everything clean? Is it clear? So you can see how this sort of helps us open a door that we've never been able to see through before in terms of following how patients' response to their treatment has been, and another tool to help us make sure that cancer has not come back before pictures might even see it. Next slide. So you get the blood test done, right? We're looking for the fingerprint. And how do you interpret the test when it comes back? Well, the test can come back with 2 different scenarios. One is the test can come back negative. So that means that they do not see any of the fingerprint. They don't see any of the 16 DNA elements in your blood. And that's great news. Great. it can come back positive, saying that the blood test does detect cancer DNA in your blood. So some cancer cells may still be present. Now, you may feel fine, okay? So you've had your treatment, we're following in survivorship, and the Signatera comes back positive, and you're like, doctor, I don't feel a lump. I have good energy. I'm not having any pain. I'm not having any headaches, no bone pains, nothing. I'm feeling fine. Well, that's where this test shines, because it is able often to detect a recurrence of breast cancer almost a year before pictures see it. I've seen this myself in the clinical setting. I've been doing it with some of my patients for over 4 years. I've had some patients where they were negative for that fingerprint from the get-go. And then we did surgery and we followed them in survivorship and everything was great. And then it popped positive. And then we did imaging of the breast and we found a local recurrence, which means we found that the cancer recurred in the breast. And that was great to find that early because it's small and be able to take that out and resect that and help that patient. I've had other patients where we've been following them in survivorship and everybody has the dreaded hormone blockade therapy, which I totally understand. And I've had some patients say, I don't want to do that. I know my tumor is fed by hormones, but I want to do my surgery, do my radiation, and I want to see how I'm going to do. Which your body, your choice, reasonable for you as the individual should you choose that. But I've had patients that choose that path and I followed them with Signatera and a couple years later it pops positive. Now this does not mean every single patient is going to do that. This is just an example. But in those cases, imaging's negative, right? The disease is tiny. It's little DNA segments in the blood. Some of those patients I've put on hormone blockade therapy when they didn't do that previously. And then we watch the number go back down to 0. So this can be very helpful for not only the patient, but also their physician in terms of not only identifying that a recurrence is going to be happening or is happening, but also perhaps changing the medication plan. So this is where the test really shines in terms of identification and actionability. Next slide. So here's an example. So the issue with the Signatera, the issue that is a good issue, is it's telling us a story, and that story is being told over time, right? So think about like you get your mammogram, it's a picture in one moment, right? You get your breast MRI, it's a picture in one moment. The blood test is basically a picture of fingerprint in one moment. But what's good about the blood test is, once again, as we discussed, it's done at routine intervals that you discuss with your doctors. So we can see over time what's happening. So for example, here, you can see this picture. Initially, you have the dot that's up near the 50 mark. This patient had a positive Signatera, and this is at the time when they were newly diagnosed with their breast cancer. So they haven't undergone any treatment at all, okay? So this is their baseline. They then got chemotherapy followed by surgery, and you can see that line drop down and then go down to 0, and it stays at 0. That's a great response, right? So if somebody initially had cancer DNA in their blood, we did all of the appropriate standard of care management, whether it's chemotherapy followed by surgery, followed by radiation, etc. And as we follow this over time, that number staying at 0, that gives the doctor and the patient confidence that their cancer is not there, okay? And if in the future that pops positive, it also gives us a heads up that we should be looking for that recurrence of breast cancer. That is very powerful for both the patient and the physician. Next slide. So how long does it take to get results, right? Everybody's waiting. You get your pictures done, you get your biopsy done, anything. It's the waiting that kills people, and I totally get this. So in terms of the very first time you do Signatera, there's a lot of work that goes into it. So remember I told you you have your initial tissue biopsy that told you that you had a breast cancer. They have to get the DNA from the tissue. So they got to get those special 16 DNA elements from the tissue. And then they got to analyze your blood. So that's like a lot of work for them to do. So that first Signatera test can take about almost a month, 3 to 4 weeks to get the results back. Now, after they get that initial fingerprint, like they got it, okay? So they know what they're looking for. So then after that, the results come back quicker. It might take about a week or 10 days for the results to come back. Next slide. So let's see the whole story, like the whole journey, right? So you see your physician and you talk to your physician, and your physician talks to you about this blood test. And if this is something that is agreeable to you, that you want to have this blood test to help follow your story of your cancer cure, just another tool in the tool belt to make sure that nothing's coming back, then your provider would put in for the test to be ordered. And then one of two things would happen. Natera, so that's the company that does the Signatera test, has mobile phlebotomy, which means they have blood draw technicians that can literally drive to your house, your coffee shop, your grocery store, wherever you want to meet them, and they can draw your blood. Alternatively, the doctor may have a blood draw person in their clinic that can draw the blood for you. Either way works fine. It just depends on what's available and what's easiest for you. We have some patients that live super far away from Indianapolis, and they don't want to be coming down here every 12 weeks to get their blood, so they will do mobile phlebotomy. And that's fine. It's efficient and it's easy for the patient. Regardless of how the blood is drawn, the blood is then sent to the Natera Corporation, and they do all those fancy tests on the blood to look for the fingerprint and the 16 DNA elements. And then once again, as we discussed, the initial report takes about 3 to 4 weeks to get back. And then after that, it's about 7 to 10 days. Next slide. So Natera has a lot of resources, and I encourage you to go online and look at these resources. It will just give you more knowledge, more power. Next slide. So visit Natera.com, and it has a patient website with a ton of information, talking not only about genetic testing that Dr. McKinley eloquently outlined, but also talking about that Signatera fingerprint DNA blood test. And then the other thing too is talk to your doctor. You know what I mean? Tell them, I've heard about this Signatera blood test. What is this? What do you think about this? Sounds pretty interesting to me. Is this something that you as a provider can offer me and follow along this journey with me, not only with imaging, but also following my blood to make sure that the breast cancer stays away. And if it does come back, that we catch it as soon as possible with all available tools in the toolkit. Next slide. So takeaways, important points, people. So Signatera, once again, I can't emphasize enough, this is an individualized test to you. It's a fingerprint of your breast cancer specific to you. It is helpful to you and your doctor. If there are signs of cancer remaining, like maybe we take more lymph nodes out, maybe there's different kind of surgery we should be doing. And also, maybe there's additional treatment. We want to cure this stuff, right? So it's like Goldilocks and the Three Bears. We don't want to undertreat you. We don't want to overtreat you, right? Both things aren't good. We got to know what is exactly needed to treat your breast cancer, and what are the things we need to utilize to help us know what the best path forward is. Now, the Signatera can also track disease burden over time. So once again, if you're getting chemotherapy before going to surgery, we can see, I mean, is the blood level, of the positive DNA going down? Is it sort of staying stable? Those are important for both you and your providers to know. And then finally, in survivorship, right? We're following you, you feel great, which is excellent. But if the breast cancer comes back, we want to make sure that we catch that thing as soon as possible. So this is just another way to sort of open a door and peek through and help us analyze if breast cancer is recurring. All things are important. So I want to state mammogram's important. MRI can be very important. Other whole body imaging can be important. This is another thing that can just assist both your providers and the patients. Okay. In terms of coverage, right? Healthcare is expensive. So Signatera is covered under Medicare. They have a compassionate care program, which once again, you can go online and take a look at it. Natera offers mobile phlebotomy. The blood people come to you. This is a free service. And they have a customer experience team. I mean, if you got a question, call, you know what I mean? Or you can get online. So there's just lots of resources for you to learn more about both the genetic testing, the Empower, and the Signatera. Next slide. And you can take a look here. You can use your phone. Learn more at natera.com/oncology.
Thank you very much for that, Dr. Giblin. That was That was really great. I'd just like to remind everybody, if they haven't got a chance to yet, to put in your questions in the right hand corner of your screen. There's a section that says questions. You can type in easily, and our panelists here would love to answer that. I think we have a couple that have come in here initially. My colleague Chance is going to ask for us.
Yeah. So the first question is about Empower. Dr. McKinney, it says, if Empower finds something, does that mean that my kids or my siblings need to get tested too? If so, how do I have that conversation?
That is a hard conversation to have. Thank you for the question. It does not automatically mean that your siblings or your children are positive, but if you have something that comes back positive on the Empower test, then they should be tested to see if they carry the mutation. Now, this can be very hard to discuss with family and or children. At least siblings are adults, and you can certainly have the conversation about, hey, I took a test, and this test has come back as a positive genetic abnormality, something that's present in our family that we didn't know about. It can increase our chances for certain cancers. And you are able to be tested if you would like. I can give you the information about my tests, and you can also be tested if you're interested. And then it's kind of up to them as to whether they um, want to or not. And I've certainly seen that go many different ways, where a lot of family members don't want to know, and they don't get tested. And then some family members are very proactive, and everyone in the family gets tested. All siblings get tested. Children are a little bit of a different scenario. Um, Usually, depending on the abnormality, unless it is a specific abnormality that is a leave from meanie mutation, where very young children can present with cancers at an extremely young age, then those are certainly conversations that you want to have with your pediatrician, and not necessarily your young child. But we usually will start testing young adults at about the age of in their 20s, because we start screening and following them, at least from the breast standpoint, doing MRIs at age 25 for those young women who could be positive.
Great, thank you so much. And then to follow up on that, another one came in as you were answering. It says, sorry if I missed it, what genetic mutations increase your breast cancer risk?
So definitely the BRCA 1 and 2 are the ones that have the greatest risk, about an 87 or so percent chance of having breast cancer. Then PALB, PALB, and then the number 2 on it also has a higher breast cancer risk associated with it. Those are our 3 highest ones. But then there are other syndromes. CHEK2 also is one that can be associated with breast cancer, and that, especially if present in a young woman, we are more aggressive with young women with that mutation as well.
Awesome, thank you so much. Alrighty, Signatera, a couple of Signatera questions. First one is are there ever false positives with this test?
Exceptionally rare, exceptionally rare. The false positive rate for Signatera is somewhere around 1%. Very, very low.
Great. That's good.
Yeah.
The other one says, what should I tell my primary care physician about my test results?
About your Signatera test results?
I'm not sure. So let's maybe go from the approach of if a mutation does come back, what should that discussion look like? And then because it doesn't mention.
Okay, so we'll both tackle
We'll
it.
start from the top. We'll just answer from
Okay.
both sides.
Certainly, if you have a positive genetic result, then that post-testing counseling is given in the office, or should be given by the person who ordered the test, or certainly you can talk to the Natera patient team who can give you information. But for the most part, what I do is talk to my patients about the result, whether it's positive, negative, or that little VUS, and what that means going forward. And you're also given a paper copy of that result, which goes into great explanation about what your result means, what it doesn't mean, and next steps that you should take. With regard to the primary care physician, you can share those results with your primary care physician. If you're found to have a mutation that requires increased surveillance or advanced testing, then it's important that you continue to see those physicians that are going to follow you from the high risk standpoint. And I think your primary care physician will be updated as to anything that happens from that standpoint. But usually you are followed by the specific physicians that are following you for high risk.
Great. Okay, we have a couple more Signatera ones. Says, do I need the Signatera test more than one time? If so, why?
You absolutely need to test them more than one time, because once again, the goal of Signatera is telling a story over time. So let's phrase it in a couple of different scenarios, right? Your initial test you get is positive before we do any treatment. Well, it would be great to know if that positive number goes down to 0 after treatment, right? Instead of just having a positive number and then it's hanging in the air and we never know what happened. That sort of doesn't make sense, right? We want to know what the story is. How's it going to end, right? So then the other part is, let's say your initial result starts 0. That's awesome, right? But breast cancer is like a ninja. It's like a virus, right? So sometimes little breast cancer cells can hide and they sleep. And then over time, they decide they want to wake up. So that's why we order this test as serial testing over time, even in survivorship, because what was 0? That was that story then, right? But each chapter in the book changes, right? They don't stay the same chapter. Sometimes the chapters change, and then that test is positive. And if we only did a one spot check, I wouldn't know what was going to happen 2 years from now. So the story matters.
Right. And our last question, which kind of reflects the other question about false positives, it says, what does a negative Signatera result actually mean? I want to feel relieved, but I also don't want to put my guard down too soon.
100%. Yeah. So a negative Signatera means at that moment in time, that chapter in the book, we don't see any breast cancer DNA circulating in your blood, which is awesome, right? But I understand you don't want to put your guard down. Totally get that. That's why we want to follow you over time. My guard's not going down just because of 1-0 test is great, but I want to follow the story to its completion. That's why we do serial testing. So I understand the guard's not going to go down. It probably never will, but I want to at least be able to accurately follow the narrative of the story.
Ryan, that was the last question.
Well, I have one other one that I thought of for the caregivers out there. If the caregiver is there talking about Empower and Signatera, with their wife and their doctor, what kind of things should the caregiver be writing down so that they can help their loved one after?
You want to
Yeah.
go first, Dr. Goodwin?
So that notebook, okay? Because like you're getting a ton of information thrown at you, whether it's talking about genetic testing, talking about your breast cancer management. Not only would I write it down, I'd record it. I would definitely record it, because then the caregiver can play it back to not only the patient, but themselves, to make sure that they can sort of marinate the information and then digest it and make sure they understand each element of the patient's care. Genetic testing is one part. Signatera is one part. breast cancer is a journey. There's a ton of stuff going on, and it's all going on at once, right? Like you got some medical college, you got genetic testing, Signatera, MRI, maybe another biopsy. I mean, there's a ton of stuff that comes. So recording it, I think, is super important for that caregiver to do.
Yeah, I echo that. I mean, it's great when you have a caregiver or someone there with the extra ears to hear what is being said, because we as clinicians, we're trying to give you so much information so that you're certainly informed, but we realize there's so much information. And that's where, you know, certainly our support system, which is your support system, patient navigators, and you know, our nurses are extremely important, so that you are not expected to know everything at that first, second, third, you know, visit. But I think, you know, certainly writing down even, you know, some big things, genetic testing, how will my cancer be monitored, what happens at the end of treatment. Those are like big ideas that will a lot of times flag us to, you know, talk about those things individually if we don't touch on them initially, or to go back again and reinforce, you know, what we've discussed before.
Excellent. Well, thank you, Dr. Giblin and Dr. McKay, so much for taking the time to answer these questions and you know, tell us more about these great offerings from Natera and how patients and caregivers can help themselves along this journey and advocate for themselves. Really appreciate that. So with that, we'll go ahead and conclude, you know, this program. Thank you again.
Thank you.
Thank you.